Do you have prostatic cysts? What to know? Have you ever wondered what prostatic cysts are and if you might have them? Prostatic cysts are fluid-filled sacs that can develop within the prostate gland. They are quite common, especially in older men, and are often found by chance during imaging tests for other health issues. Most of the time, these cysts are small and do not cause any symptoms or need treatment. So, what exactly are prostatic cysts? They are cavities lined by epithelial cells and filled with fluid. These cysts can be found in different parts of the prostate. There are midline prostatic cysts, which are located centrally and usually representing normal variations. Then there are lateral prostatic cysts, which may be linked to chronic inflammation, such as prostatitis. Now let's talk about symptoms. Small prostatic cysts typically do not cause any problems. However, larger cysts can lead to issues like difficulty urinating, urinary retention, or even obstructed urine flow. They can also cause urinary tract infections due to urine retention, blood and semen, and sometimes pelvic pain or painful ejaculation. In rare cases, cysts might be associated with malignancy, but this is uncommon. The symptoms you experience largely depend on the size and location of the cyst. How are these cysts diagnosed? Most often, they are discovered through imaging studies. Transrectal ultrasonography is commonly used to visualize cysts inside the prostate. Other imaging methods like abdominal ultrasound, computed tomography, or magnetic resonance imaging may be used for larger or more complex cysts. Sometimes, additional tests like urinary flow studies or cystoscopy may be necessary to assess any urinary obstruction. What causes prostatic cysts? Several factors can contribute to their development. Chronic prostatitis or inflammation, benign prostatic hyperplasia, and ejaculatory duct obstruction are some common causes. Congenital abnormalities can also lead to midline cysts, while prostate atrophy or rare tumors may play a role in some cases. Most prostatic cysts do not require treatment if they are asymptomatic. However, if a cyst causes symptoms or complications, treatment options may include minimally invasive procedures like cyst drainage or aspiration. In more severe cases, surgical removal may be necessary, especially if there is significant obstruction or recurrent infections. Emerging techniques like interventional radiology may also be considered in select cases. It is important to note that prostatic cysts are generally benign and not cancerous. However, in rare instances, they may be associated with or mask prostate malignancies. Therefore, careful evaluation is essential, especially if symptoms persist or imaging shows suspicious features. Regular prostate cancer screening and monitoring are important for men at risk. If you have prostatic cysts that are found incidentally and you have no symptoms, they usually do not require intervention but should be monitored. If you experience urinary symptoms, blood in semen, pelvic pain, or recurrent infections, it is crucial to consult a healthcare professional for evaluation. Imaging and urologic assessments can help distinguish cysts from other prostate conditions, including cancer. Personalized medical advice from a urologist is vital for proper diagnosis and management. In summary, prostatic cysts are common, mostly benign fluid-filled sacs in the prostate. They often cause no symptoms but can sometimes lead to urinary or reproductive issues. While they are generally unrelated to prostate cancer, proper diagnosis and monitoring are important to rule out malignancy and manage any symptoms effectively.